Is there an association between scoliosis and sciatica? So what are the most common symptoms associated with sciatica? First thing, it's going to be low back pain. Pain in the lower back between your ribs and your waist, and it's normally worse on one side versus the other. The second thing is going to be pain radiating down into one of your legs or both legs. The pain would normally go down the back of your leg where your hamstrings are, down into your calves, and then it will typically radiate into one of your feet as well, and normally crosses over the back of the foot and into the big toe. It can go down both sides or down one side. This very often causes mobility issues because when it causes this pain, it causes radiating pain, and it can also lead to something like numbness or paresthesia. I mean, you have a lack of feeling in the area, mostly in your toes or your feet or down the back of the leg. It can be very debilitating, it can cause a lot of pain, and it can really kind of leave you locked. A lot of times patients will say, my back went out, and they have pain going down your leg. And then the most common way you evaluate this thing is you're taking some films. You're taking some x-rays to see exactly what's going on with the spine. And when you take these films is when you can discover if the patient actually has scoliosis. Now, sciatic pain is not common in kids. So a lot of times, even if the child would have scoliosis, they won't feel any kind of sciatic pain. However, sciatic pain can be very common in adult cases with scoliosis. And in fact, when adult cases with scoliosis, sometimes the very first thing that brings on the diagnosis is actually pain itself. So the question is, can scoliosis cause sciatic pain? 100% can. Whereas when adult cases with scoliosis, because what's causing the progression in an adult case is gravity over time. So gravity over time will cause the spine to compress and curve further out of alignment, and these unnatural curves are associated with scoliosis, are also associated with the causation of sciatica, which is basically pressing on the nerves that exit the spine, which are called the sciatic nerve. So how do we take care of it? How do we get this thing better? How do we improve somebody that actually has sciatic pain? Well, the most obvious thing is just to treat the symptom. Treating the pain tends to be very often done with pain management types of procedures. These are like medications, or these are like injections that can be done to help kind of numb the nerves. Even those things numb the nerves and they can make you feel better for a short time, they're not decompressing the nerve itself. So therefore, very often the pain can return and can come back and continue to cause problems and other issues. As sciatica progresses and this nerve pressure progresses, it can change from pain into numbness, and then it can eventually lead into weakness. And that's when things become more complicated. So I always recommend take a very proactive approach if you're feeling any type of sciatic issue, is that you want to start restoring structure. You don't want to be just dealing with the pain. So more proactive approaches tend to be more like chiropractic adjustments, exercises and stretching, and it could be specific scoliosis bracing, specific scoliosis rehabilitation. Now, these things are going to help improve the pain, but most importantly, they're going to help deal with the structure of the spine. Because if you're changing the structure of the spine, you're preventing the gravity from having those negative effects on the nerve tissues, which are what causing the sciatica to begin with. So number one is that you want to, if you have sciatica and you know you have scoliosis, you don't want to treat just the pain. You definitely want to start treating the structural problem. If you have scoliosis and you don't have sciatica, you want to be proactive in terms of keeping your curve as low and as little as possible, because the bigger the curve progresses, most likely as an adult, the more likely it is to cause more issues like low back pain and sciatica. So keeping the curve down can prevent that, help increase your quality of life, and also improve your longevity over time. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.